Now at 5:30, Women's Health Headlines, where we focus on health stories specifically impacting women. And doctors are noticing the COVID-19 vaccine can cause some swollen glands, which is a normal reaction, but it can also affect a mammogram reading. Joining us now is Dr. Diana James, the Director of Breast Imaging at Jefferson Radiology. Dr. James, thank you so much for being with us.
Thank you so much for having me.
So explain a little bit about what exactly is the connection between the vaccine and screening mammograms and ultrasounds.
Absolutely. So after you receive the vaccine, it's a normal response to have swelling of the lymph nodes under the arm on the same side that you got your shot. So if you had the shot in the left arm, it's somewhat common to have the lymph nodes under your arm or sometimes even above the shoulder swell a little bit. Pfizer and Moderna estimate about 10% of patients that are getting the vaccine have this issue.
So if a woman has recently had the vaccine, when do you recommend them scheduling their screening mammogram or ultrasound?
So we recommend scheduling that exam at least 4 to 6 weeks after that second dose. So data shows that for most patients, their lymph nodes will go back to normal about 10 days after the vaccine. So just to be safe, we recommend scheduling 4 to 6 weeks after that second dose date. If you missed your mammogram in 2020, and I know a lot of us unfortunately did because of the COVID pandemic, we recommend just coming in when you can, regardless of your vaccine schedule. Ideally get the vaccine and then don't hesitate to get your breast imaging.
I know a lot of us had to miss appointments because we were nervous, but the message is now make sure you head in. As the head of breast imaging at Jefferson Radiology, what has been your overall experience with COVID-19 and mammography? Is there something in particular that you'd really like our viewers to know?
Just honestly, I know a lot of people are really nervous about still even coming in for a checkup. We have very safe precautions. Many places have extra screening where they're checking temperatures at doors, making sure that no sick patients are being seen in the same places where we're doing screening mammograms and ultrasounds. So I think it's very safe for anybody to come in. I know there's still a couple people still waiting from last year. So I would just really encourage them to come in, get your vaccine, try to schedule the mammogram before you get the vaccine. If you can't do that, then just get the mammogram 4 to 6 weeks after that second shot if you're in a 2-dose protocol.
All right, that is the key time, 4 to 6 weeks. A lot of good information there. Dr. James, thank you so much. We appreciate it.
Thank you for having me.